you see people that have changed their lifestyles also adopting exercise routines as well with food?
Yeah, and I'm sure Kelly would speak to this too. Dietitians are really speaking to lifestyle medicine, right? Not just macros and micros. It's about compassion, building relationships. Our medical director is Dexter Sherney, the past president of the American College of Lifestyle Medicine, right? So, yeah, this is whole person care for sure.
Any other thoughts on that, Kelly?
I was just going to say, when I started my business 12 years ago, everything was in person, and I could only reach so many, and now I can reach globally, and that is a huge, huge change. But yes, on our platforms, exercise is always incorporated in, but there is definitely a ripple effect that happens with the entire family. So everything that we're putting together across all three of us is for the entire family, and it creates that ripple effect across.
Yeah, the thing I would add on the technology front, outside of telemedicine, is also, when we think about food as medicine, we're solving a lot of big systemic problems. We're also solving some patient problems. And so one of the big systemic problems that needs to be solved for this to proliferate is the fact that our doctors, our primary care doctors, who are often the first line of defense, have very little nutrition training. I think the average is, Kelly, is this right, 5 to 10 hours over the course of a 4-year degree?
One semester. My husband is a doctor, so I can tell you it's for real.
So, one class, one semester.
One class, one semester.
Yep. And that makes it really challenging when a patient shows up at their primary care provider, has some labs done, is diagnosed with a condition, and then the provider has to give them advice and can't on this front, right? And so some patients get directed to a dietitian, some of those patients continue with a dietitian, some do not, some never reach out. We really need to be able to meet patients wherever they are in their journey and with whatever tool they want to be reached with. And so what we've done is we've taken, they were talking about AI in the last panel, we will talk about it here, but we have taken as a machine learning based model that says, okay, if you're a patient that has this health condition, this allergy, this intolerance, this dietary preference, you hate cilantro, you love tikka masala, and you're never giving up caffeine. We take all of that information and we put it into our machine learning model, and we're like, okay, cool. Based on all of this information about you, this is the food that you should eat, and here's where you can buy it on BiteWell to get to that next step in your journey and to start integrating lifestyle medicine. And that is a much easier tool for a primary care provider to hand to someone and say, hey, check out BiteWell, they can help you figure out what to eat, than going through the entire re-education process of all of our primary care physicians to integrate nutrition. So that's how we think about technology.
Excellent. As many people know, as you age, people start to develop chronic disease conditions. And so it's typically not just one chronic disease condition. Someone may have diabetes, may have chronic kidney disease, they can have coronary artery disease, they can have, you name it. There's probably 37 different chronic diseases. I thought there were 19, but there's 37.
Such a number, where did this number come from?
From you, I think. But anyway, it was really interesting that we see people having multiple chronic disease conditions. So a lot of this is attributed to poor eating, poor quality of food. So, in your experience, have you guys seen, and I'm going completely off script because I love this topic, have you guys seen reversing of like diabetes or other conditions because of the change after that 40-week period, or a lifestyle change that continues on, hopefully perpetually?
I'll grab this one. So 80% of the chronic diseases that we have in America are preventable, and probably 90% are treatable. So that's something that we love to inspire people and empower them that they do have the ability, even if they do get a chronic disease, that they can change that. They have the power over their own health. But it is amazing that most of the patients that we see have never been told that they can reverse their chronic disease. And that is something that is shocking still today, and why I personally joined the American Heart Association Board, to start talking about this, to stop talking about lowering salt, but how you can prevent it. So, and it's really food as medicine that's going to get us there.
Excellent. So, personalized medicine, precision health, let's talk about that. I think it's really important to understand how, understanding those disease conditions, understanding the treatment for those disease conditions, the education I find this all the time in population health. I teach courses in that, and education is the thing that's lacking. Once people start to be aware of it, they dig in, they understand it, and they'll start following, the path. So can you guys talk a little bit about precision health and how you actually help to curtail these activities?
Sure, I can start. I'm going to answer your question by not answering your question, and then I'll answer your question. So.
Tricky.
I know. Tricky I am. We use terms a lot within these spheres and outside of them, like precision nutrition, like food as medicine, like chronic condition. These aren't terms that patients use. And so when we think about precision nutrition or precision medicine in the patient's term, what does that mean for you as a patient? It means that my healthcare meets my needs, right? And so when we think about precision nutrition within the context of our world, what we're thinking about is how can we meet this patient's health need, and how can we fit that health need into their life, as opposed to trying to push it in the way that we want to push it on them. And so when we think about what our model takes into account, it doesn't just take into account their conditions, their medications, it also takes into account what foods they like, what foods they don't like, how they like to cook, how active they are. It takes into account what their life looks like. And when we understand what a patient's life looks like, their willingness and motivation to change, what is that motivation driver, and then the important things like conditions and medications, etc., we can build a program that works for you, the human being. And so that's how we think about it. We actually take the buzzwords away and we go to the patient and say, okay, what does this mean to you? It means, how do I fit this healthcare need into my life? Excellent.
I love that, and I just wanted to bring up the pink elephant in the room, GLP-1s. Everyone's head. So everyone keeps asking me as a dietitian, what do you feel about this? How do you feel about this? Again, just like Sam said, we have to reach people where they're at. And so being a dietitian and being in this food space, we are here to truly reach them where they are, and that's where precision nutrition comes in. If you are taking a GLP-1, we do need to change your nutrition to increase your protein, to reduce that lean mass, muscle mass wasting. So that's where precision nutrition comes in. So it doesn't matter if you're coming in as a vegan or eating keto or wherever you are in the spectrum, we have to reach them where they're at.
Yeah, and I'll just add, this is about so much more than education, right? It's relationship. When you're talking about someone's diet and their lifestyle, by nature, it is personal, and by default, it's individualized, right? And so that's the beautiful thing about dietitian care and support in combination with technology, is you can build that, you can share compassion and trust and so forth. And I'll give you an example of just how personal this can be. We work with CalAIM here in California. They will pay for medically tailored meals, 12 weeks of our meals, along with dietitian support for any member that has a chronic condition, which in the Medicaid world, that's the majority, right? And at our company, what we do is all of our all-hands meetings, we will share a patient impact story, which is shared by the dietitians, by the way, so we live vicariously through the dietitians. But at one of our recent all-hands, what our dietitian shared was that she was working with a woman, it was a single mother, and she was just describing to our dietitian it was really hard for her to provide healthy meals for her children because she works, she comes home, she's tired, she wants to engage with the kids, and doesn't have time to cook something healthy. I'm sure that resonates with other folks here too. Our dietitian was just sharing crockpot strategies, right? Something that you could set it, forget it, come back and have a healthy meal for your kids. This woman started crying. And she said to our dietitian, I never had a mom or dad be able to teach me these types of things. Right? And so, if that's not personal, what is, right? Every time a dietitian is speaking to a patient, it's an invitation into their home, right? To get into a real health and well-being discussion. So, by default, I think all of this is hyper-personalized, for sure.
Thank you.
Can I say one more thing on that too? I think having telehealth has helped a lot, actually getting into their house too, where patients can go into the refrigerator, into their pantry, and we can see that, and we can really work with them for what's going on in their lives and what's in their pantries.
I'm gonna keep going. Is that fine? We really are. We always are. I think in answering this question, the other thing that's come up is what are the challenges that food as medicine is solving? We've heard education, we've heard relationship. The other side of that spectrum is access and affordability, right? Not just of food, which is very important, but of food as medicine solutions. So I'm going to tell a opposite story to the story that you just told, a story that hurt my soul a little bit this week. I was chatting with a health plan, and the person who I was chatting with, I was sharing what we built, and I was sharing, the cost, and it's, less than X number of cents per member per month to give them access to this tool, et cetera, et cetera. And then we were talking about dietitian services, and we were talking about all the things that go along with food as medicine. The person who I was speaking with was very honest and said to me, Sam, it is less expensive for me to keep this patient on a statin for the rest of their life than to give them access to the level of services, especially the one-on-one dietetic services that you're talking about. And so how do you help me help them by getting them access to some sort of care less expensively so that I can be incentivized to take them off of this medication? And that is one of the biggest challenges that we face. And so if there is anyone in this room who has the ability to influence that and to help us change the narrative, and it is changing, right? It's especially changing within the Medicaid space. Medicaid in several states have done incredible work to bring this to people, but how can we change that narrative more broadly and prioritize paying for the care that people need in the way that they need it? And I think when we talk about this space, we have to address the challenges as well.
Well, part of this is navigating challenges and embracing opportunities, and obviously you've all done that in your roles and working together. It's three separate organizations that work in unison, which is really impressive. So what challenges and opportunities arise when incorporating food as medicine into the healthcare systems, considering both the technology and the societal aspects of this?
I think the opportunity is huge. I was saying outside, the ball dropped in 2024, and it was like, let's go. I feel like there's a huge shift. I don't know what happened if the earth shook. I don't know what really happened, but I've been in this industry since '96, and it has never felt like it is today. And so I think the opportunity is just so huge, and people are ready for it, and there's conversations like we're having today. I mean, I'm in California from New York with Sam and sitting here with these people. I mean, it's really exciting. So I think the opportunity is just going to explode. Yeah.
Any other thoughts?
Yeah, I think we've talked a lot about challenges, so I'm going to talk about opportunities. To recap challenges, we've got education, we've got affordability, we have access, we have relationship, we have not just education of the patient, but also education of the provider. Lots of challenges. On the opportunity side, what we're seeing are signals both at the regulatory level, so governmental bodies changing the way that they talk about food as medicine, at the system level, so health plans, health systems, really reimagining what food as medicine and nutrition services could look like, and then most importantly to me, at the patient level. People speaking up and saying, I want to reverse, I want to prevent, I want to do all of these things through food. And we're seeing that now in popular culture with things like the You Are What You Eat documentary launching on Netflix right at the beginning of January and becoming one of the most watched documentaries that they've got. People are ready. They're ready.
We have time for one more question. I just saw the big number come up. So I know a lot of people are probably sick of hearing about AI. I've been in technology 30-odd years of my career, and I'm kind of tired of it. I know what it does. I know how it works. And it's overused. There's no question about it. But looking at data analytics and AI in dietary health, how are data analytics and artificial intelligence being used to analyze the impact of dietary choices on health outcomes? And what insights can be gained from these analyses? And what tools do you guys use to do this without people being engaged?
Yeah, take a stab at this one. First of all, AI. For Christmas, I got all of our kids GLP-4, or whatever you call it.
ChatGPT-4.
ChatGPT-4. And by the way, that's because I'm thinking about GLP-1s, but ChatGPT-4, the paid version, I mean, it's here, it's coming. You don't even measure progress on AI in years, you measure it in months these days, so it's going to be impacting everything in life, it's pervasive. But what I will say is that the more technology increases, the more you need human-to-human contact, right? We see that with social media, we're going to see that with AI, and when we think about dietetic support, and when we think about food as medicine, technology is an enabler, right? Enable health, it's an enabler, but it does not take the place of human-to-human contact. And so there is no way that AI can provide empathy, compassion, can understand your childhood and how that's impacting why you eat the way that you eat today, and hold you accountable the same way that human-to-human interaction can take place. So yeah, I'm bullish on AI. It will help. And last thing I'll say is just what AI can help with are task-oriented things, right? So a dietitian note-taking and data entry into an electronic medical record. Let's AI the heck out of that. Awareness campaigns, AI the heck out of that. You know, recipes. I mean, really what BiteWell is doing is automating a lot of what a dietitian would have done manually previously, right? Creating shopping lists and menu guides and weekly rotations, and you're doing it in a fashion that you could never have standardized as a dietitian, and it wouldn't allow it to scale the way that you're doing it today. So it's critical, but it's not like AI. I mean, it will take over the world someday, but not dietitian support.
I don't know. Can I disagree?
Please.
Okay. I've seen, there's a robot that I learned about. I was in Dubai a couple of weeks ago, and I learned about this robot that is being put into older people's homes, and it is an empathetic AI model that converses with them, remembers how they felt the day before, asks them how they're feeling today, like really deeply empathizes with the human. And so I do actually think that AI is going to be able to provide a level of kind of empathy and human interaction that we've never seen from technology before. I don't think that that replaces a provider, but I do think that it supplements a provider, meaning if I'm out at 11:30 p.m. and I'm with my friends and we are starving and I need help, I'm like, you know, at a pizza shop and I'm like, oh my God, what do I eat? That's not gonna totally derail me from my needs. I can't text my dietitian at 11:30 p.m. I shouldn't. Some people do. I shouldn't text my dietitian at 11:30 p.m. for advice, but I could interface with an AI model that understands the circumstance that I'm in and can help me to navigate through that in that moment in time. And so to me, it can be a really wonderful care extender for a provider. And I have a lot of questions about what happens when AI empathy mimics human empathy.
I'm just going to close it with our whole tagline is real people promoting real food, and I do believe you need a real person. I worked in bariatrics for 3 years. The situations that come up, you would not tell a robot. There's just a human thing that happens between the provider and the person. But I do think AI can be a supplementation, almost like supplements to a diet. But I don't think they're going to replace real food, just like supplements, and I don't think dietitians are going to be able to replace. I think you do need to have that person in place that you can connect with. But definitely I don't want to be called at 11:30 about your pizza, because I'll just join you.
Well, I want to thank this wonderful panel and open it up for any questions from the audience. I know Mark has some microphones out there.
Yeah, I think we've got time for one question. Let's see, 2 hands.
Well, I actually have a statement, not a question.
All right.
So you might be able to get both in.
Quick statement.
I just want to ask, well, first of all, I'm super excited you're here, as I told you guys, because I just love food as health.
Yeah.
So that was going to be my point, so I'm all about trying to support the transformation from sick care to health care, and value-based care payment transformation is obviously the solution to what you're saying. And I just want to say, I hope we continue to say food is health and not just food is medicine. So,
There you go.
Agreed.
Great point.
+1.
So I listened to quite a few books, and I'm curious if you guys have listened to Dr. Peter Attia's new outlet and Medicine 3.0. I mean, you guys are the details, but you want to work with guys like that, right?
My husband loves him. He listens to me on his driving to work every day and tells me all about what he's learning on gut health. I'm like, yeah, I've been telling you that for the past 5 years. So I think I need a robot at home for compassion. But there is some good information out there, but I do think it's still a lot of noise is out there, and a lot of influencers and people that don't have actual health degrees are giving information. And so that's where, again, I feel like bringing this together, these 3 individuals basically, is really helping get true information and real food message out there.
What was the question exactly?
So I guess the question is, so the concept of Medicine 3.0, he is an MD, so that's a broader picture.
Yep.
So he wants to get payers to pay for the treatment plan you guys produce. Right now, he says, I have nowhere to, I can't.
That's right. There's no code. Yeah.
How do I bill for this? So getting more people like that together might be a
So just so you know, dietitian services right now with almost all providers is a covered service, and you don't need a doctor recommendation to see a dietitian. So just so everyone, a lot of people don't know that in the room, that you can start using these services without having a doctor recommend it.
And on that note, there's no copay or no coinsurance, almost always with dietitian support. So yeah, these are covered programs and becoming more and more so,
Yes.
which is a good thing. Yeah.
And I think what Peter Attia is talking about is like a lot of the longevity related services that are currently not covered and coded, and that is a
But he's bringing health span instead of lifespan, right? Like, to your point about January, it's like, what just happened?
Yeah.
I feel like Outlive had a huge influence on
It did.
people's awareness of the term health span versus lifespan.
And we gotta keep that going, so let's get on your podcast.
yeah, and
Sorry.
I think there are 2 ways that transformation like this can happen. It can either happen top down, meaning governmental and regulatory bodies saying you must cover XYZ, or it can happen bottom up with patients demanding these services and demanding coverage. And the best way that it happens is when it's both. And so, write to your representatives. I know that's, we don't do that anymore, but it does still work. So write to your representative, tell them what you want to have happen, help hold them accountable to push them through, and then also keep voicing this from the ground up, and eventually those 2 worlds will meet.
Well, thank you very much for your time this afternoon. We certainly appreciate it and appreciate these experts on the topic of food as medicine. So thank you very much.
Thank you, John.